Good morning, everybody. It's welcome back to my daily webcast. It's actually going to be 3 times a week, but I'm still calling it a daily webcast. That's false advertising. But this is Jonathan Garber with Flying Chimp Media, and I'm reaching out to leaders in the community to ask them for their best ideas on how we can not just survive during the coronavirus crisis and shutdown, but how we can truly thrive. And we're still looking to live our best lives ever for ourselves and for our family. So I have a terrific guest today, Charles Maurice from the TSI Group. That's Tomorrow's Solution Insurance Group. Did I get that right?
You certainly did, sir.
All right. So Charles from the TSI Group, Charles Maurice. And Charles, tell us a little bit about yourself and TSI Group.
Hey, first of all, thanks very much, John. Nice to see that you're looking good and healthy. Hopefully everybody in the family is too.
Yes, thank God.
I work for a company called TSI. We are a supplemental or voluntary benefits insurance company. We've been doing this for over 20 years. Started when the industry was in its infancy, and now that there are large numbers of companies in the state offering these benefits, we are at the forefront of not only providing benefits, but doing something that very few agencies do, which is personalize the plans so that they match with health insurance, which would make sense, as opposed to just throwing product out there. But also we brought technology in, so we've invested in our clients. So we have a software that will not only give information to our clients within 10 seconds, but will also do something completely unique in the industry, where we can help our clients file claims in about 10 seconds. So everything is pre-filled. We guarantee that the claim forms are the correct claim forms. There is an algorithm inside the system which will help calculate the amount of your claim. So if you're not getting paid enough, it comes back and gets you. So it's the next level. I would say we are the cutting edge, state of the art, and that's what really makes us different from everybody else.
Cool. So that's something for people to explore, but I wanted to talk to you about some kind of economic questions.
Sure.
And you'd be my first guest to really get into the economics of what's going on. I think we are all acutely aware of the economics of the shutdown, the service industry, people losing their jobs, certainly temporarily or permanently, who knows. I'm sure many restaurants and service type industries will not open again. And so I'm plugged into that. I think we see that. What I'm concerned about, and I'll make it personal, for example, is let's say, for example, I got coronavirus. Maybe I would fight it, be just fine, relatively young for risk factors. Okay. But if I have to go to the hospital, even for one day, just for isolation and observation, waiting for test results, and then they give me prescriptions, for example, these are not generic drugs that are $7 at the drugstore. These are hydroxychloroquine. No, there's none of this is generic, a Z-Pak. Who pays for that? Is there a federal program that's paying people in those sorts of, are they giving you those drugs for free?
Okay, so there are predominantly 3 types of people today in today's health insurance world. There are the folks who have private health insurance, maybe from an employer or directly with a health insurance company. People who are covered by a state program like Medicaid or Medicare for the elder people who are retired. And then there are the folks who have no insurance at all. And they kind of are dealt with in slightly different ways, but at the end of the day, it is still a bill that somebody is responsible for should they get hospitalized. So let's start, if I may, with what we like to talk about, exposure. So I often ask people, what's your exposure? And they look at me blankly, deer in the headlights, and go, huh? I go, if you had to spend a night in a hospital, how much would it cost you out of pocket? And most of them go, I have absolutely no idea. But a lot of them have a clue that it's going to be money. So today, the average overnight cost out of pocket is somewhere between $1,000 to $3,500 to $4,000. And that's from health insurance. And we're going to sort of focus more on the private side, because if you're on Medicare, most people on Medicare have a good idea of what their coverage and their exposure is, and they have Medicare supplement plans, and Medicare Advantage plans, things like that. Believe it or not, the older you get, in many cases, the much more informed you get, because you have to deal with that's a surprise,
Right.
especially people who are on fixed incomes.
Sure.
There are then the people who have no coverage at all, and that is a big risk, because if you have no coverage and you get a bill from a hospital, that's your bill. That's it. You can negotiate with the hospital, but that is your bill. For everybody else who has some level of insurance, the way it works is that the insurance company has already got what they call pre-negotiated rates with providers. So you go to a hospital and you have a bill for $25,000. If you have insurance, the insurance company comes along and says, okay, well, that's great, but our negotiated rate is 13,000, whatever the number is, 12,000, 15,000. So you've gone from 25, no insurance, to maybe 12, 13 through the insurance company. And then the insurance company says, but you are responsible for, okay, your deductible. So you're in the hospital overnight. On my insurance, it's $3,500 for an overnight stay in the hospital, and a maximum of $6,500 out of pocket for the year, assuming that everything that is provided to me is provided in network. And kind of like a little 101 on medical terms. In network is your insurance company says everything that you get is provided by somebody that we've got a relationship with. If they don't have a relationship, then it's out of network, and the fees for that are generally a little bit higher. But let's stick with that. We're getting into
Right.
So let's stick with the idea of this deductible. Pretty much most plans have what they call a hospital deductible, an overnight. So if you get hospitalized for whatever reason, and this is what people seem to be ignoring at the moment, there are many things that can put you in a hospital, not just COVID-19. A lot of people finish up in the hospital in this time of year because of flu. There are lots of other flus out there. We have a friend who's just finished up in the hospital because of their back pain. There are lots of reasons you can finish up in a hospital, not just the current virus concerns. So when you go there, in many cases, what's going to happen is the hospital will get your insurance details. They will then send the bill to your hospital provider, your insurance provider. The provider will come back and say, okay, this is the bill, this is how much we're going to pay, this is the responsibility of the patient, and then they're going to send you a bill. And that bill is going to be in line with whatever your exposure is. So in my case, one night in the hospital would be $3,500. It's up to me then, how am I going to pay for that? So there are a couple of ways you can pay it. The first one is you have the cash. I don't know that many people who have a bank account that says, here's the money I have set aside in case I finish up in the hospital overnight, or here's my out-of-pocket deductible for a year, which is usually a much bigger chunk of money. Or, God forbid, as what happened to me 10 years ago, I finished up being diagnosed with colon cancer, completely healthy now, thank goodness. But I was diagnosed the week before Thanksgiving. So I had a session, I was in hospital about 10 days the week before Thanksgiving and afterwards, had some surgery, went home, and then the following year started treatment. So I didn't just have out-of-pocket deductibles for 1 year, I had 2, but nobody thinks about that.
Right.
So my out-of-pocket deductible was $6,500, and because of various billing issues and in-network, out-of-network, I finished up with 2 years of $9,000 maximum out-of-pocket bills. And I was like, oh my God, where did they come from? Don't get me wrong. Absolutely delighted to be alive. Thank God for the medical community and my insurance. I got great care. But I still finished up with this hole of my exposure of $18,000 that I had absolutely no concept as to, I was going to have it or how to deal with it. And that can be for a lot of things, including, you mentioned the prescriptions. We talk about cost of prescriptions and specialized prescriptions. Again, the insurance company is going to say, this is what you're going to be responsible for, this is what we're going to pay. And at the end of the day, it could be either a drug they don't even cover, which you may say, I need it to survive, in which case you're probably going to get it and try and pay for it somehow. Or you can appeal to the insurance company and maybe they'll give you some kind of help or not.
But those wheels turn very slowly.
Yes, they do. So at the end of the day, the responsibility is your responsibility. How do you pay for that? So in the old days, a lot of the hospitals would deal with you directly and say, hey, how much can you afford to give me? And if you really had nothing, they'd say, well, let's put you on a payment plan.
Right.
But in the old days, the payment plan, if you didn't own anything and you didn't have any assets and et cetera, you could finish on a payment plan, I don't know, $50 a month essentially for the rest of your life. Today, it's a little bit different. Some years back, when the hospitals were having a billing crisis, they went to the state or the state management and they said, help. And the state management said, okay, what's the problem? They said, we're just not getting paid enough money. We're essentially at 100% capacity. Help, we can't get any more money from our investors because we're not making enough and we're full. So what the state said is, well, how about we get you the money? So they got into business relationships with the banks, where the banks started to buy the debt. So the hospital got the money they needed. And now when you get a call from the hospital's financial services department, it's not the hospital, it's the bank. And when the bank calls you and says, hi, it's the financial services department of the hospital, how would you like to pay your $5,000 bill? You're going to pay it. If you have money, they may negotiate with you if you have cash, which is a very great position to be in. If you don't have the cash, then they're going to put you on a payment plan. And they're going to look at your level of income, and they may look at your level of expenses, and they have, in some cases, financial aid forms and things like that. But they're going to come back and they're going to say, yeah, $50, no. We want $150 a month until this is paid off. And one of the interesting things they say is, but don't worry, you don't have to pay interest on this, because you could be looking at paying this bill for 3, 4, 5 years.
Right.
And that is true. You're not paying interest on it, but they bought your debt for about 50 cents on the dollar.
The pennies, right.
Right. So, they bought your $5,000 for $2,500. You're going to pay back $5,000. They are delighted. They're getting 20% a year. The alternative is, like I said, that if you have some cash, which is a great position to be in, the hospital is often willing to negotiate. So in my case, I was able to negotiate usually between 20 and 25% from the bill by giving them cash. So if you have cash, it's a great place to be. So the question is, do you have cash? Do you have the access to the cash? Or do you have other ways of paying your deductibles? So there are a couple of ways to protect yourself as a consumer against the deductibles. One is obviously, yeah.
Let me ask you a question if I can. So it's like, one of the things that really concerns me, it's a couple of concerns, is that people afraid to use their insurance because they know there's $6,000, $7,000. If they got a family, they might have a family copay. They're afraid to use the insurance, so they're not going to get treatment for something like COVID-19. They'll say, I'll just treat it home, like grandma treated flu. I'll have chicken soup and hope it goes away.
Right.
But so they're never counted in the numbers. They're never tested. They're never quarantined. They basically go through no protocols other than what their grandmother did. That's one concern, is that they're afraid of the cost, so they don't seek treatment. And then the kissing cousin to that is they've got diagnosed, they got prescriptions, and they can't afford to pay either full price for a med that's not covered, because insurance may not keep up with approvals for treatment. So
Yes.
when they say, yes, the FDA cleared hydroxychloroquine yesterday, which I think is what happened yesterday.
Okay.
That doesn't mean your insurance company recognizes and covers that today.
Correct.
You still may pay several $100s for that, and that's a discounted rate.
Correct.
Federal government, state government, there's no government agency that's handing you a bag of drugs and saying, go home and take this. You're not acute enough to be hospitalized. So I'm worried about people not even trying, and then getting a diagnosis, getting a prescription, and then being afraid of the economic consequence. And a lot of people, you may not even be laid off or fired, but if you're a business owner, you may not be taking home a check. And so that $150 a month could be food, right? So those are some of my concerns, because no one has really, I haven't heard any leader, any state, federal, local leader say, don't worry, we have a program, a meds program. I haven't heard about any of that. Have you?
No, I haven't either. The concern you have is a very well-founded concern, because it's not just now. I mean, we're talking ongoing. People's aversion, or even just being straight scared by the financial impact of having to use their health insurance. You know, I was in the emergency room with my eldest daughter some years ago, and saw a mother say to a doctor, "Don't admit my son. You know, what are you going to do?" "Oh, we're going to observe him." "Well, how about just come back tomorrow morning?" And the doctor said, "Well, why?" She said, "Because I can't afford the exposure." Well, she didn't say exposure, but I can't afford to have my son admitted, you know, put in the hospital overnight. That's a scary thing, but you know, we hear horror stories. We hear
those are people with insurance have horror stories. That's the thing.
Correct, right? But and the people who don't have insurance, who are needing prescriptions that they can't get, or they have insurance where they can't afford the prescription. A friend of my eldest daughter unfortunately passed away because of an acute asthma attack in the end. And she couldn't afford the prescription because it was $150 for the inhaler. And they were asking around to try and find somebody with a spare one. And while it all went down, unfortunately, the person died. You know, they called an ambulance, but it was all just too late. So it's not just now, but you know, now everybody is looking because now everybody is worried. So you have your finger really on the mark and the pulse of this. There is no protection. If you're in the hospital and they are treating you, they're just going to treat you. If you are at home and they say, "Here is a prescription," you're going to be responsible for paying for that prescription. If you can't afford it, you're not going to be getting that prescription, as I understand it. I don't know of any program yet, if you have your own insurance, that is going to cover that prescription. I know there are certain sort of mum and pop pharmacies still who may extend some level of credit to people, but I think those are few and far between these days.
But again, that's taking on personal debt. And
yes,
if the insurance company considers the treatment at this stage experimental,
right.
If you're in a test group, if they say, "We don't know, but we think you should take this."
Well, you're back again to what you said before, which is timing of everything.
Yeah.
You know, first of all, the people not wanting to go to the hospital is very real. The people not wanting to be treated is very real. You know, the saying, if you have certain symptoms, then please take care of yourself, because you could finish up infecting not just your family, but a lot of other people too. And that's very scary. I mean, the numbers of increase overnight in Miami-Dade, you know, you can see that there are big problems coming, and that's what they're saying. In terms of personal responsibility, yeah, right now it's all on you. And we kind of get back again to that whole discussion of, how do I cover my exposure? So if you don't already have the protection in place, there are a couple of things you can do. But on a personal level, there is 2 levels of protection. You've probably seen the ads on TV for Aflac.
Right.
Where, you know, what does Aflac do? Well, Aflac is an awesome company when it comes to claiming supplemental or voluntary benefits. What they say is, we help cover the cost that health insurance doesn't. And in many cases, we can help put money in your pocket if you have a sickness or an injury and you're no longer able to work, or along those lines. But it's not just Aflac. There are, I believe right now, 52 companies in the state of Florida who are licensed to provide those types of services. Many years, not so many years ago, it was about a dozen. So you can see that this area has become much more profitable and much more attractive to insurance. Right. And at the same time, health insurance, the number of companies has shrunk dramatically from about 12 to about 4.5 in the state of Florida. So you can see that the sort of profit center these days has gone much more towards supplemental voluntary benefits, as we call them. These are benefits paid for by the individual or paid for by the employee. There are two ways to get them. One, you can go directly to an insurance company, and most insurance companies who are in the market will allow you to do that. And you say, yeah, I want the accident coverage, I want the hospital indemnity plan, I want to get a cancer plan, maybe never diagnosed, already diagnosed, critical illness, heart and stroke plans, that type of thing, along with short-term disability. And you can get also simplified issue life insurance. Those are these sort of the big six when it comes to supplemental or voluntary benefits. There's also something called gap insurance, which is ideally there to help you cover that deductible hospitalization. What a lot of people don't get. I'm not a huge fan of gap coverage, but there's obviously a place for all insurance if you plan it right. The gap insurance is there to help you cover deductibles, but it won't necessarily put money in your pocket as well. Because here's the reality, if you finish up in the hospital, you are unlikely to be generating an income because you're in the hospital. So unless you can be in two places at once, you know, you're in the hospital, you're not working, you're not making money. So my preference, which is why obviously I work for Tomorrow Solutions, is the voluntary benefits side, because in many cases, not only can we cover most, all of the deductible, but in a lot of cases, we can put money into the pocket of the person to help them cover the other bills they have. That's really
lost
important.
Wages and things like that.
Whatever it is, you know, at the end of the day, if somebody hands you a check, and we are generally, and I say we, the royal we are an industry that will hand somebody money in a health crisis when everybody else is saying, pay me, pay me, pay me. So from our perspective, if I give you a check for $3,000, $4,000, $5,000, do you care what it's for? No. You just want to make sure I've got money that I can cover that deductible, and maybe I can negotiate with the hospital because now I have money. I have money, so I have a level of strength and a position of strength I didn't have before. And then what's left, because if you can negotiate a discount, then everything that you negotiate, that's yours. So you get to keep it, and now you use it towards your bills. So,
Mortgage,
you know,
car payment, utility, whatever.
Insurance, food,
We all have bills.
whatever it is. So, you know, my attitude right now is a lot of people looking at what their exposure is. It's the human condition. People don't look until it affects them directly. But now people are looking and they're saying, well, God, what happens if ... So my recommendation would be, if you have a insurance advisor or you know somebody, go talk to them, all right? Because you can only get insurance when you're healthy. Excuse me. That is kind of the rule. The best time to get insurance is when you're healthy enough to get it. You know, I've been in the insurance world quite a long time, and occasionally I'll get a phone call from somebody saying, oh, I want that insurance now. We go, but we've been talking about it for 3, 4, 5, 6 months. What changed? Nothing. Well, something changed. Well, yeah, I had a physical yesterday. My blood pressure is through the roof. I said, well, you know, that's unfortunate. You're not going to be able to get that life insurance coverage you wanted.
Nobody underwrote it.
Until you've been on medication for 6 months or 9 months and everything is calmed down. But why? You know, because you get insurance when you're healthy enough to get it.
Right. As we say, nobody knows you when you're down and out.
Absolutely.
That's the old song. So just to cut through some of this, because we're going to have to wrap.
Yes, sir.
And make sure that, you know, when you're in a business, you're in the insurance business, it all makes sense to you. When you're a lay person and you start hearing certain terms, the eyes roll back in my head, is when I normally hear terms like gap coverage, I think of stuff around Medicare and Medicaid and a donut hole, and you can fill the gap and get a gap policy. But just so people understand, they can get a gap, an individual, a schmo like me, can get gap coverage between where my insurance leaves me hanging and where I need to be. And I could get specialized policies for cancer or accident or whatever. As an individual, I can actually go get these from somebody.
Two levels. You can get them individually, and you can also get them through your employer.
Right.
So individually, go find a health insurance agent. They should be able to help you with pretty much all of those. And again, what I would say is try and put together a plan or a package that probably has coverage from a whole bunch of different areas so that you can cover all of the bases. And then on the corporate side, it's mostly from the HR. They can bring in a company like ourselves who would look at what is already there and then come in and then bring a package together of benefits so they work together so they're strong and it makes sense. If something doesn't make sense, employees are really smart today. You know, we've got the internet, so it's easy to ask questions. But if something doesn't make sense today, why would you do it? So if it doesn't make sense to the employee, then employers, when they bring in benefit companies, the health insurance, their benefit company together, if it doesn't make sense, you know, it's kind of like this. If they have low participation by their employees, it's because it doesn't make sense. Right. So what you need to do is have a company that will come in either with your existing, or maybe that needs to be tweaked as well, and then bring in plans that work together in unison so it makes sense and everything will be strong. The employees will see the smart and the sense of it, and they will take it, and then everybody will be protected. Because let's be clear about this. If you have employees who get sick or have a health crisis in their family, it's very clear, statistics show the first people they come to is their employer.
Right.
So for the employer to protect themselves and for the employee to be protected too, really good idea to work with a really good agency, advising company who can help you do that. Because that's really what this is all about.
But I think there's an opportunity for customization there because people's circumstances could be wildly different. The concerns of a 25-year-old and the concerns of a 55-year-old are different. And the concerns of people who are just starting to maybe have a family and think about having kids and those who are looking at grandkids, you know, their needs are very different as well. And this is an opportunity then to customize what they get and what they need. All right. We are out of time, but Charles, thank you so much for getting up early and meeting me online to do this. We appreciate your knowledge and time, and I thank you very much.